Have you ever wondered how crucial it is to understand the spectrum of suicidal thoughts? Today we're venturing into an essential facet of mental health, the spectrum of suicidal thoughts. This spectrum varies from passive desires to escape life's hardships to active plans for self-destruction. Recognizing these signs isn't just about detection, it's the first step towards effective intervention. By grasping this spectrum, we're better equipped to provide timely support, potentially saving a life. Understanding suicidal thoughts is not just about detecting a problem, but is the first step towards effective intervention. Suicidal thoughts can range from passive desires to escape life to active plans for ending one's life. This spectrum, from passive to active, is something we must understand to provide timely and effective support. Passive suicidal thoughts are often characterized by a desire to disappear from life or to go to sleep and never wake up. These thoughts can be distressing. They may not necessarily lead to active planning, but they should never be dismissed. They signal a deep emotional pain and a need for mental health support. Moving along the spectrum, we encounter active suicidal thoughts. This is when someone is not just thinking about wanting to die, but they're contemplating specific methods or making detailed plans to end their life. Recognizing these signs is crucial. Active suicidal thoughts indicate an immediate risk and necessitate urgent intervention. The difference between passive and active suicidal thoughts is significant, but both are serious. Both indicate a person is suffering and needs help. Moreover, passive thoughts can evolve into active ones without timely intervention. But how do we recognize these signs? They're not always clear-cut. It requires attention, empathy, and a willingness to listen. Behavioral changes, expressions of hopelessness, or subtle hints in conversation can be indicators. It's crucial to be vigilant and responsive to these signs. Recognizing these signs is not always straightforward, but it is a crucial step in providing the necessary support. So let's continue to learn, to understand, and to reach out, because understanding the spectrum of suicidal thoughts can be the key to saving a life. Identifying the signs of suicidal thoughts involves more than just listening to what is being said. It's about observing changes in behavior, such as withdrawal from social activities, shifts in sleep or eating habits, or an increase in substance use. These changes can often be subtle, but they are critical indicators of an individual's mental state. Expressions of hopelessness, feelings of being a burden, or talk about death are also significant signs that should raise concern. It's often through these indirect expressions that someone may be hinting at their distress, yet it's not just about individual behavior or expressions. The broader context matters. Significant life changes, trauma, or a family history of suicide can heighten the risk. Stressful life events such as relationship problems, financial difficulties, or health issues can often act as triggers. So, while listening is key, it's also crucial to look beyond the words and consider the overall context. It's about seeing the whole picture, understanding the spectrum of suicidal thoughts, and recognizing the signs that someone might be at risk. If you notice these signs in someone, it's important to respond with empathy and concern. It may feel uncomfortable or daunting, but your kindness and understanding can make all the difference. Start by approaching them gently, expressing your worry and your willingness to help. Ask them compassionate questions about how they are feeling. Remember, it's not your place to offer solutions, but rather to listen, to validate their feelings, and to encourage them to share their thoughts without fear of judgment. It's crucial to highlight the importance of professional help. Encourage them to seek therapy or counseling, or to reach out to a trusted healthcare provider. If they're hesitant, offer to accompany them or assist in finding resources. Your role doesn't end with a conversation. Keep checking in on them, reminding them that they are not alone in their struggle. Remember, recognizing the signs is just the first step. Following through with support and professional help is crucial. As we wrap up our discussion, let's ponder on our role in this critical issue. It's not just about understanding the spectrum of suicidal thoughts, but acting on that understanding. If you notice the signs, reach out. Your words could be the lifeline someone needs. Encourage them to seek professional help and offer your support in that journey. Remember, it's through our collective efforts that we can combat this silent epidemic. Being aware and taking action can make a life-saving difference. Let's make that difference together.